Hello everyone, good day. I am Keisha Nuevo, student nurse of Davao Doctors College. And today I am going to perform the basic life support for adults, child, infants, and newborns return demonstration. Basic life support is an emergency management provided by the first responders, healthcare providers, and public safety personnel to people who are experiencing cardiac arrest, respiratory distress, or an obstructed airway. Now, I'm going to perform the adult cardiopulmonary resuscitation and AED skills. First, I am going to begin with the assessment and activation. So, I arrive at the scene and I see that the patient appears to be unconscious. The first thing that I am going to do is to scan the area, left to right, up and down. Check the environment for any hazard present. A hazard could be a fire, falling debris, chemicals, or anything that could potentially harm us, because if there is a hazard present, if we do not get injured, therefore we will be unable to help and assist the patient. Now, since the safety would also include the use of personal protective equipment such as the gloves, which we'll be using later performing the CPR. Now, I'm going to perform the adult cardiopulmonary resuscitation and AED skill first. I am going to begin with the assessment and activation. So I arrive on the scene and I see that the patient appears to be unconscious. The first thing that I'm going to do is to scan the area. Left, right, up, and down. Check the environment for any hazard present. As a hazard could be a fire, falling debris, chemicals, or anything that could potentially harm us, because if there is a hazard present, and if we get injured, therefore we will be unable to help and assist the patient. Now, since safety would also include the use of personal protective equipment such as the gloves, which I already have in here. Now, after ensuring the scene is safe, I am going to check the level of the victim's consciousness and responsiveness by tapping the patient's shoulder and asking if he is okay. Sir, are you okay, sir? Sir. While I'm doing that, I'm also assessing whether the patient is breathing normally. Is in diagonal respirations or just not breathing at all. So now I see my patient has no movement, has no response, and it is not breathing. I am going to activate the emergency response system. So, are we going to do is that we'll have to ask a standard to call 911 immediately. You, ma'am, in a blue shirt, please call 911 immediately. We have a patient here and I need help. So after doing that, I'm going to turn back to my patient and then check the patient's pulse and breathing again. So if the patient is wearing a constrictive clothing, we'll have to loosen it up. And we'll have to check the patient's mouth as well to see if there is anything that causes the obstruction of the airway. We also have to remove the dentures if there is any. So I'm going to check my patient's pulse and breathing. 1, 1001, 1002, 1003, 1004, 1005, 1006, 1007, 1008, 2009, 2010. So I have determined that my patient has no pulse, he's not breathing, and is unconscious. I am going to proceed now in performing the cardiopulmonary resuscitation or the CPR. CPR is a life-saving skill that is combined chest compression with artificial ventilation to maintain the lung function until further measures are done to restore spontaneous blood circulation and breathing of the patient who has gone into the cardiac arrest. So now we are going to do to deliver the high-quality chest compression. First, locate the chest area of the patient. Place the heel of one hand on the top of the center of the patient's chest. Now interlock the finger over the patient's body. Have your elbows locked straight and then start doing 30 chest compression at depth of 2 inches, 1 to 30. Then interlock. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, and 16, 17, 18, 19, 30. Now ensures that there is a complete chest recoil for each compression. after doing the chest compressions, immediately administer 2 rescue breaths to the patient. I am going I am going to get my back mask or my barrier device, and I'm going to cover the patient's mouth and nose with it, and head tilt and chin lift to open the patient's airway and deliver the rescue breath. So each rescue breath should be given over a second, and there should be a visible chest rise of each breath. Now, after doing that, you have to continue doing the chest compressions and then proceed to the rescue breaths again until the AED arrives, or until an emergency responder arrives to take over. Now, doing 30 chest compressions and rescue breathing while waiting to be very exhausting, and if we do get exhausted, our compressions becomes less and less effective. So in order to avoid that, we'll have to ask a bystander or a person that is someone who easily taught how to CPR, or someone who already knows how to do CPR, so that we could have someone to switch roles when we get tired, so that we'll have enough time to regain our strength and maintain high quality chest compressions. Now, I am going to proceed with the AAD skills. So, until the AAD arrives, we'll have to continue doing the chest compressions and the rescue breaths until the AAD is ready to analyze. So, assuming that I am the second responder, what I'm going to do is to turn on the AAD. After turning it on, I am going to quickly scan the patient's chest. If the patient's chest is hairy, we'll have to quickly trim, and the areas in which the AAD patches of the AAD will go, because hair will act as a barrier, and then the AAD might not be able to deliver the greatest shot. So AAD, also known as the automated external defibrillator, it is the complex yet to simple use medical equipment that analyzes the heart's rhythm, and if necessary, administers the electric shock or defibrillation to help the heart to establish an effective rhythm. So now I'm going to place the patches. One will go over the upper right area of the chest just below the clavicle, and other one will be placed beneath at the patient's armpit below the nipple line. Okay, so when we have placed the patches already, the AAD will start analyzing the heart's rhythm, and it might tell us to stop doing the compressions and rescue breaths, so it is still analyzing. So after a while, the AAD might tell us to stay away from the patient, to clear away the patient and not touch the patient, because it will have to deliver an electric shock. So when that happens, we're going to do is to, everybody clear? Delivering shot in 3, 2, 1. Shot delivered. After doing that, AAD will tell us to resume with the 30 chest compression and rescue breath, how many cycles, and then after that, it will reanalyze again the patient's heart rhythm. And if necessary still, it will deliver an electric shock. So we'll continue doing that until the AAD tells us to stop, or until the patient has already revived. So after everything, doing all the procedure, we have to document the procedure done, the time the resuscitation started up until the time it is ended. Now I am going to proceed with the pediatric resuscitation. So this involves a child or an infant who is need immediate resuscitation. So basically, the steps in doing this procedure is just the same with the adult CPR. The only difference is the number of hands or the fingers used in the chest compression. So to begin, we'll still have to check the environment. Make sure that the scene is safe. Next, we'll have to check the patient's level of consciousness, and if the patient is not responding, then we'll have to activate the emergency response. Baby, baby, can you hear me? Baby, baby. You, ma'am, in a blue shirt, please call 911 immediately. I have a patient here and I need help. Now, after doing that, we'll have to check the patient's ABCs. the airway, breathing, and the circulation. We'll have to open the patient's airway. So if the patient is wearing the constrictive clothing, we'll have to loosen it up. We can also do the head tilt, chin tilt to still open the airway. Now, after doing that, we'll have to check the patient's breathing using the look, listen, and feel method. Look for the chest rise and fall, and then listen for the breath sounds, and then feel for the respiration of the air. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So the patient is not breathing. I'm going to give the patient 2 rescue breathing. I'm going to get the face mask, cover the patient's mouth and nose with it, and deliver the 2 rescue breaths. So after doing that, check again the patient's breathing and pulse. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, I see that the patient is not breathing and has no pulse. I am now going to proceed with the doing of cardiopulmonary resuscitation. So my patient here is an infant. Infants are within the age range of 1 month to 1 year old. And so in order to deliver the chest compression, we'll have to use the 2 or 3 fingers, or we could also do the thumb technique like this. We encircle the baby's body using our hands. And then, let our thumb rest on the chest area of the patient and then start the compression. But I'm going to use the 2 finger or 3 fingers method. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. After doing that, immediately gives the patient 2 rescue breaths. Now we'll have to do this compression and rescue breaths until the help arrives or until the next responders arrive to take over. Now ensure that in doing chest compressions, there is complete chest recoil and depth of the compressions is only at 1 to 1 and half inches because we don't want to fracture the baby's bone. Also, for every rescue breath, there should be a visible chest rise. Now, if the patient is a child, so children are within the age range of 1 year old to 8 years old. So, we'll have to perform the chest compression using one hand. Place the heel of one hand still at the lower half of the breastbone and then give the patient 30 compressions and 2 rescue breaths. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 6, 7, 28, 29, 30. So still the depth of the chest compression should be at 1 to 1 and half inches and then give the patient 2 rescue breaths. Now, after doing that, continues doing the cardiopulmonary resuscitation for at least 5 cycles and then check the patients for the signs return of the circulation. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now, if the patient already has return of the circulation, we have to place the patient in the recovery position. So, how do we do the recovery position? Well, we have to replace the arm at the nearest to you and the right angle and then grab the hand that is placed that farther side. Place the back of the other hand on the patient's cheek and then hold it there. Grab the farther knee, flex it, and then grabs the leg to roll the patient to the side. That is the recovery position. After doing that, we'll have to wait for the rescue responders, and then after doing everything of the procedure, we'll have to document the procedure done. Hello, good day. Now I'm going to perform the newborn cardiopulmonary resuscitation. So since this is a newborn, the first thing it will have to do is is to determine the baby's APGAR score. APGAR is a quick test done at 1 minute and 5 minutes after birth. The 1 minute would tell us that, well, the baby tolerated the birthing process, and the APGAR score of the 5 minute would tell us how well the baby is doing outside the mother's womb. Now, for this return demo, let's say that the baby has the APGAR score of 3, which will now falls within the concerning range. This means that the baby is need for an immediate resuscitation. So, determining the baby's APGAR score will have to check the baby's responsiveness by tapping the shoulder, rubbing the soles, and calling out name loudly. Baby, baby, are you okay? Baby, baby. So after doing that, and the baby still has no response, we'll have to call for help to activate the cold blue or doctor's quick so that the doctor and the nurses could come over and help us to revive the baby. So what we'll have to do next is to open the baby's airway. So we'll have to suction the baby's mouth nose using the suction valve. We'll have to remove the secretions if there are any that is obstructing the baby's airway. After that, we can also do the head lift and chin lift to still open the baby's airway, and since the baby did not respond to stimulus within a while ago, we'll have to perform the positive pressure ventilation or the PPV. So there are two types of positive pressure ventilation or the PPV. It could be through the invasive, which is through the use of the ventilator, or the non-invasive one, which is through the use of the pediatric valve mask. So for this demo, I am going to use the valve mask. So here is my bag valve mask. What I'm going to do is to cover the baby's mouth and nose with it. Now, hand position would be thumb and forefinger at one hand will be placed at the rim of the bag mask. Then, to ensure the pressure sail and remaining fingers will be placed on the jawline of the baby, this is done so that our hand is not leaning on the patient's eye and compressing the baby's neck and is supporting the baby's head. So, we'll be delivering oxygen to the baby. Be sure to maintain the proper facing. So what we're going to do is breathe through 3, breathe through 2, 3. Breathe through 3, breathe through 3. So PPV should be done 30 seconds of the ventilation or 40 to 60 seconds per breaths per minute. Now, after doing that, someone will be attaching a cardiac monitor and pulse oximeter to keep track of the baby's heart rhythm. And the pulse oximeter measures the hemoglobin oxygen saturation, and this will help us to monitor the efficiency of the CPR. So, if there is no increase of the heart rate after performing the PPV, we'll have to proceed to perform chest compression and rescue breaths. So, how are we going to do to chest compressions? So, since this is a baby, we can do 2 or 3 fingers to locate the lower half of the breastbone of the baby and start the compression. But we also do the 2-thumb technique. We're going to encircle the baby's body using the hand and circle the thoracic area of the baby. Then let the 2-thumb rest at the center of the baby's chest. Start doing the compression like this. But I am going to do the 2 to 3 finger technique. I am going to begin chest compressions, 30 chest compressions to rescue breath, and chest compressions will be depth of 1 inch only. The baby's bone is not strong enough to handle immense pressure, and we don't want to harm the baby by fracturing its rib or rib cage. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Then give 2 rescue breaths. And then do repeat the chest compression again. So we'll have to continue doing that for at least 4 cycles. And then if still after doing the CPR there's no still increase of heart rate, we'll have to continue doing the CPR and prepare to assist for intubation. Intubation is where a doctor will insert a tube through the patient's mouth or nose down to the trachea to keep the trachea open and allow air to pass through. However, if the baby has an increase of heart rate after the compression and the rescue breathing, then we can proceed to the post-resuscitative care wherein we could refer to the pre-resuscitative care algorithm because we could find there the procedures and tests that needs to be done to ensure the baby is doing fine and baby's body system are working. So post-resuscitative care is through monitoring the administered oxygen concentration and the arterial oxygen saturation. So after doing the procedure, we'll have to proceed to the documentation process, which includes the time when it started, ended, and also the procedure assessments, the response of the baby to the treatment medication given.